call. Dr. Siegel, good morning.
Good morning, David. Great to be on with you.
Thank you. So, Mark, as you know, June is Men's Health Month, and there has been a lot of controversy about who should be getting colonoscopy, when to go for testicular exam. They basically dismissed PSA. The government talked about the PSA as if it's not a good test, and we know it's not a sensitive test. And as we get more sensitive tests and biomarkers and genetic tests and more urine tests like PCA3s coming in, PSA is still the standard of care that has reduced the mortality and risk of metastases over the last 2 decades. What do you tell your men out there, and I'm sure you talk to their wives and spouses, what's the big message to them out there during this month?
Well, in terms of PSA, David, I think the first point to make, and you've made it many times, is that prostate cancer is usually an invisible disease. So you don't have any symptoms to go by. I need something to go by. And what I tell people is, look, the PSA gives me an idea that something's wrong with the prostate. If the trend is going up, which is why your point about testing it at the age of 40 is so important. Most of the time at the age of 40, it's low. Well, that's good, because then if it goes up, I could say, hey, there may be a problem here. And we don't say that the problem is automatically prostate cancer. It could be an infection, it could be an enlarged prostate. You start to observe the trend. Maybe I've seen you do this many times. You treat with antibiotics for a possible prostatitis. Maybe you image the prostate. You do a rectal exam to see if you feel a nodule. Then you start talking about biopsy. It's the best tool we have. Sensitive or not, it tells us that there's something wrong with the prostate. I think it's really irresponsible for the U.S. Preventative Services Task Force, a bunch of non-urologists, as we both pointed out, to say it's not valuable, because then people are going to be diagnosed with advanced prostate cancer, and then you have a much, much worse problem.
The point is well taken. And as if you remember, like in September of last year, I came up with this concept of Samadi challenge. And I know that you've been on board and you've actually encouraged a lot of women out there to bring their men to get tested, whether it's for thyroid disease, whether it's for cholesterol, blood pressure. But of course, the emphasis was, number one, find out, learn what your risks are. That's very important. And the whole concept is to improve your quality of life. Then it was screening, and if you have a problem, it can be treated. It can be medical treatment, or it could be a surgical treatment. And that is something we want to emphasize today. We're also, as you know, Mark, we're using a lot of new genetic markers in our practice in order to find out which patients should go to the operating room and who should be observed.